In this video, we'll watch a demonstration of an end-to-end discharge workflow and address some common errors. Identify the patient you wish to discharge and open their chart. The Discharge Navigator can be found under the Discharge Activity tab. For a surgeon, discharging a post-operative patient can be completed from the Post-Op Navigator. Proceed to the Post-Op Activity, then to the Discharge tab to find the Discharge Navigator. For a surgeon, discharge activity can also be completed through the MRP ATT section. Click on the MRP ATT activity and proceed to the Discharge tab to find the Discharge Navigator. If you have questions about the appropriate navigator to use, look over to the DC Instructions section. You may notice some best practice advisories in the Best Practice section. In this example, a missing code status order in the patient's chart. The 24-hour results section lets you quickly review lab results from the last 24 hours. The Unresulted Labs section indicates pending lab results. The Outstanding Imaging section shows a list of imaging orders that were ordered during the current encounter but have not yet been performed. This section also includes orders that have been scheduled but waiting to be completed. It is important to note that if you wish to have these orders performed as outpatient tests, these orders need to be reordered as outpatient orders. The After Visit Imaging section will allow you to access and place outpatient orders, including outpatient imaging orders. Outpatient orders are indicated by the home sign. The Cosign Orders section shows list of orders that need to be cosigned. Since the discharge med reconciliation has not been completed, the status remains as discharge orders needing review. Use the Problem List section to review and resolve any problems prior to discharge. The Discharge Summary section allows you to document your discharge summary. Click on the drop-down menu to select a specific template to complete your discharge summary. If you wish to free text any specific instructions for discharge, use the Patient Instructions section. These instructions will be displayed on the patient's after-visit summary. Based on the patient's documented principal problem, you will find suggestions on possible discharge instructions. In this example, notice a list of discharge instructions being suggested for a patient with the principal problem of ankle fracture. You may search for additional information by clicking Add. Alternatively, you may click on Clinical References for problem and medication-related instructions. If you wish to populate medication-related instructions, click on Treatment Search. This pulls in instructions on the patient's home and hospital medications. Select the appropriate instructions and hit Print. If it is a palliative discharge, use the Palliative Discharge checklist. Now let's proceed to the discharge orders. The discharge patient order is automatically pulled in. Use this search bar to search for discharge orders. The discharge orders are also known as after-visit orders. They are indicated by the house icon and are for outpatient contexts. For example, outpatient prescriptions, outpatient labs, imaging, or outpatient procedure orders. If you wish to place an order to be completed in hospital prior to discharge, please be sure to order from the During Visit section. These orders are indicated by the bed icon. You may also place during visit orders from the Orders activity. During visit medications are indicated by the bed icon and have an option to document administration. Clinic-administered medications are indicated by the syringe. They are ideal for medications that are administered through outpatient clinics. They allow an option to document administration, which is not available for the after-visit orders. Now let's move over to the Review Orders for Discharge tab. Home medications and inpatient medications are displayed in two separate columns. If a home medication was continued in its original form, dose, and frequency during the hospital admission, it will be indicated as continued on admission. For the LASIX example, the difference in order details between the home and inpatient order is highlighted. In these cases, continuing one would automatically flag the other medication for discontinuation. You have options to continue, edit, and discontinue home medications. Inpatient medications offer options to prescribe or do not prescribe. Here's a look at the prescription order composer. Prescriptions are defaulted to print. If you have a pharmacy indicated on the patient's profile, you may fax the prescription by changing the class to fax prior to signing the order. To add a pharmacy to the patient's profile, click on Select a Pharmacy and search for it using these details. You may also add outpatient lab, imaging tests, and referrals from this section. If your printer prescription was sent to the wrong printer, you can easily reprint them by proceeding to the MedRec status section and then to Discharge prescriptions. Here, you would find options to print individual versus all prescriptions. The after-visit summary is a dynamic summary of the patient's visit. It contains a snapshot of the patient's reason for visit, interventions including tests and medications, and medication lists. It also has instructions on signing up for the MyChart account with an activation code. As interventions are completed, it updates on the after-visit summary. For example, if the patient requires a follow-up, it is best to print after-visit summary after all the appointments have been scheduled. This will ensure appointments are accurately reflected on the patient's AVS. Now let's look at some common questions and errors during the discharge process. The hospital performed option is to be used for inpatient orders. Auxiliary performed is for outpatient orders. Use this option even if the patient is returning to the hospital to do the test as an outpatient. Example, patient returning to DI with an appointment for an ultrasound in 48 hours. External is for tests performed outside of the CEHC hospital network. These requisitions then need to be faxed to the appropriate testing center. Internal versus external referrals. Please refer to your organization's list of internal versus external clinics. Once ordered, internal referrals get directed to the appropriate work queues for scheduling. For the external referrals, please select the Referral to External Physician Clinic option. These requisitions then need to be printed and faxed to the appropriate clinic for scheduling. You will encounter this error when you attempt to discharge a patient who is either missing an admit to order or has an incorrect admit to order on the file. If you encounter this error, look over to your storyboard for the patient class. Then place an admit to order for that class. In this case, place an admit to rehab order. This concludes the demonstration of the discharge process. For more information, please refer to the Physician Learning Home.